Hi everybody, my name's Tim. I'm here to talk to you about neck and back pain. And what we thought we'd do is just put on a webinar to help you to talk about any back and neck problems and just to really let you know what support's out there for you if you need it. So first thing I have to tell you is we're planning to record this webinar and we'll put this on the Trevelyan House Surgery website or the Grafton website at some point, because we want as many people to be able to benefit from it as possible. So please do you mute your mics or change your names, or if you want to keep any confidentiality, please exit now. You can switch off your webcams, and I don't think that will actually. I don't think it will show any of the webcams anyway. I think it will really show the presentation. But please do, if you're not sure, please do mute or close your webcams, because this is recorded, and this will be put on for other people to benefit from this. I'll say that message again because there are going to be more people joining through the presentation as we go through. So it's fantastic. We've got, I think, 45 people at the moment, which is brilliant. So I want to talk to you today. I'm here to talk to you about back and neck pain and what is available out there for you. So let's go through let's go through the webinar. My name is Tim Allardyce. I am the clinical director of the Surrey Physio Group, and I'm a physiotherapist and osteopath. I sit on a couple of charities as well, so I'm heavily involved with an osteopathic foundation. I also sit on a family charity as well, and I run clinics in South London, and my passion is Olympic Games. So in about 2 or 3 weeks, I would have been flying off to Tokyo as physio for Team Tonga, but unfortunately that's on postponed now, and that won't be happening. But I've been to 4 Olympic Games, Vancouver, London, Rio and Pyeongchang, and I do quite a lot of work with sports people, but I also do a lot of work with the NHS, and we provide a lot of NHS services, and we're also at your GP surgery. So that's the boring stuff out of the way. Now, I wanted to tell you what provision, what there is at your GP surgery and what's available to you. So at Trevelyan House Surgery, we have a new service, and it's called First Contact Practitioner. And the idea behind a First Contact Practitioner is basically that you can get quick access to see someone who knows about the services available for rehabilitation of joint pains, osteoarthritis, back pain, neck pain, shoulder pain, elbow pain, hand pain, finger pain, Achilles tendonitis, knee pain, post-hip replacements, post-knee replacements. And this is a new national service that's been set up by NHS England. What the idea is that there's a huge demand on GP services, as you can imagine, and not enough GPs. So the idea is to put physiotherapists and first contact practitioners, they can actually be a physio or an osteopath, into a GP surgery, and then direct as many patients with musculoskeletal problems, so that's any kind of joint pains and muscle pains, into the first contact practitioner. Now, the first contact practitioner service is not designed as a physio service. It's not going to give you hands-on treatment. If you need that, I'll explain to you where you can get that on the NHS. And what this is designed as a one-stop, two-stop shop. So it's a quick access into a physio that will give you advice, guidance, give you the right information at the right time, so you don't have to wait for your GP. Now, if we need to make a prescription or medication prescription, then we can speak to a duty doctor and get a medication prescribed to you, so you can still see the physio. If it's something quite complicated, we can always go and ask the GP, or we can refer you on to a GP appointment. But seeing us first, it just saves time, and in most cases we can deal with the problem. We're able to support with fit notes, we're able to support with some insurance requests, and we're able to onwardly refer you to the community physio team. In your GP surgery, you also have access to link workers. Now, link workers is part of this new national framework set up by NHS England, and link workers are an amazing resource, and I strongly recommend, if you need support especially if there's anybody here in the older age group that need support at the moment with COVID. Please do, you have access to a link worker attached to your primary care network and your GP surgery. Now that link worker is there to support you. You can phone up your GP surgery, and you can request to speak to the link worker. Now what link worker does is they can signpost you to a number of services. You might have back pain, you might have neck pain, you might have had whiplash, you might have financial problems, you might need support for an elderly relative, you might want nutritional support, might want to get some help with food deliveries. They have access to psychological support services. A lot of these are community-based services run by charities, and they have access in and links into those support groups in Wandsworth that you can access. So they're very good port of call. Both the first contact practitioner and link workers very much work together to support you. And the key thing is support at the moment. Everybody is struggling at home. A lot of people are still in lockdown. It's been a really, really tough time for everybody. I'm talking to you from home myself, and it's been really difficult. We're seeing a lot of problems as a result of being stuck at home. And if you need support, there is support there for you. Excuse me if I just keep breaking slightly. I'm just admitting more people that are coming into the room. Good. So let's talk about back pain, which was the main reason for doing this seminar. It's very common. 80% of adults will suffer back pain or neck pain at some point in their lives. The best situation is to address it quickly. So get help quickly. The help you can get is to come and get to see your first contact practitioner. At the moment, we're doing telephone calls only, but very, very soon we will be resuming face-to-face. We suspect that will be in sort of probably the early July. It could be mid-July, but we can do a video call with you, or we can do a telephone call with you. So please do, come and see your FCP. If you need advice, guidance, support, exercises, you're not sure what to do, act quickly. Don't let your pain become chronic, because when it becomes chronic, you have a bigger problem on your hands. We can refer you for AQP physiotherapy or even osteopathy. Now, there's two systems of physiotherapy available in Wandsworth. So you can go to the community team at St George's Hospital, and they will provide you with all body parts physio, and you can get AQP physio, where you can go in and see a physiotherapist. Now, obviously, at the moment, again, it's going to be video consultations, so it's going to be largely exercises. But prior to COVID and after COVID, you can get hands-on physiotherapy on the NHS with a physio, and in some places, actually, even there is small access for osteopathy as well, and you can go and see them and get treatment. Now, it's not an ongoing service, so there's a restriction on how many sessions you can have, but the service is there for you if you're in trouble and you need care. I need to tell you about red flags with back pain. So one of the red flags we always mention to patients, especially when they have any leg pains or sciatica, is just to be cautious of any incontinence, loss of sexual function, numbness around the back passage, and these are signs of a medical emergency. So if you ever get any numbness around the sort of the seat area, or the perineal area, the anus, the sexual organs, anything like that, and it's come on suddenly, and it's not a previous problem that you've had, you need to go to A&E straight away and get it assessed. If in doubt, contact us, but this is a medical emergency. You go to A&E and you get help from hospital with regards to this. Good. So I've got some tips that I want to talk for you. So a lot of back pain can be prevented, and when back pain is very bad, we often see people doing a lot of bending. I've had a bad back myself. I've had disc problems for about 12 or 14 years. And I certainly find that bending forwards repeatedly tends to aggravate my back, especially when the back pain is quite acute. So I I always talk to my patients about trying to minimize the amount of forward bending, especially leaning over a sink, cleaning your teeth, making the bed, picking up things. Just try and bend your knees a little bit. It always makes a big difference. It takes a lot of pressure off the back. And you can use things like ice. So you can wrap an ice bag in a towel and just apply it to your lower back to reduce any pain and inflammation. Stay mobile. It's really tough at the moment with everybody in lockdown, but try and get up, move around, walk around a garden, or walk into a public, go somewhere where you can go that's not breaking the 2-meter rule. Exercise is really, really difficult at the moment, but do what you can around the house, in the garden, and just get mobile. So there's loads and loads of exercises for back pain, and of course it depends on the sort of nature of your back pain. But these are just 3 safe and easy exercises that you can do anytime you like, at home. You can just lie on your back. So the first exercise, you lie on your back, and just go back to the previous page. You lie on your back and you just let the knees bend to each side. You do that 10 times each side. What that does is it just starts to get the back moving. So it just starts to improve rotation to the lumbar spine or lower back. It's a really safe exercise. It's a great exercise to do. You can do it in your bed. You can do it pretty much anywhere. The second exercise is the side bend exercise. So you just stand up nice and straight and run the arm down, the hand down the side of a leg, and try and reach your knee crease. Now, if your back is quite stiff, you probably won't be able to get to the knee crease. And in an ideal world, you'd reach just below the knee crease. And what that does is it just helps to just get a little bit of side flexion going through the spine. And that mobility is good because the back loves to be kept mobile. So it loves to get this range of movement. And, just so many back problems can just be improved by simple things like improving range of mobility. And the third exercise does the same thing. Just sitting on your chair, just twist round and touch the back of the chair. And again, you can do this, say 10 times, 2, 3, 4 times a day, just repeating one, and that rotation helps to just mobilize the spine and get your backs moving. And improving mobility is really the key to addressing a lot of back problems. Not all of them, but a lot of them. If you improve mobility, then we can start to do some strengthening exercises on the back as well. Now, neck pain is a very common problem as well. The biggest time we see people coming in with neck pain is it's usually postural problems. We see a lot of laptop users with neck pain. We're seeing a lot of people at the moment with neck pain because they're not at their normal office setup, they're not at their normal desk, they're using laptops from home in awkward positions. And again, if you're suffering with neck pain, there is support and help available for you. You can go and see your first contact practitioner at the GP surgery, and you can bypass the GP and get access to community physiotherapy quite quickly with neck pain. Now, a lot of neck pain, like back pain, it doesn't need a lot of medication. When it's very acute, yes. Often you can manage on over-the-counter medication, but actually what they really need is necks and backs need exercises. They need the mobility, and they need to we need to reduce inflammation. So, like the back pain, act quickly. Don't let it become chronic. Address it quickly. Look at what's causing the problem. Look at what's causing your neck pain, because often it's repeated posture. It might be repeated neck bending or being in a forward hunched position over a laptop. Look at all the things that might be causing the neck pain and establish what is it that's contributing to my neck pain, and how can I address the causative factor and stop the cause and then correct my own problem. You can get treatment for neck pain as well. So if anybody wants treatment, you can get treatment for it. And the first contact practitioner can refer you into the AQP physio osteopathy to get treatment. And of course, there's loads of tips and advice about what you can do for your neck pain. So tips, well, ergonomics is really, really key. There's no doubt about it that so many of us sit at our desks with chronically rounded postures and rounded shoulders, and we end up getting short and tight through our pectoral area, and our necks come forwards, and the head weighs about sort of 9% of body weight, so it's about 8 or 9 kilos. So when that head comes forwards, it puts loads of stress through your neck, and it gives you this achy neck, and it's really, really common. It's really hard to shift. And a lot of times you just need to bring the neck back. You just need to sit upright. You need to address your posture. So we always talk to patients about laptop use. I mean, laptops are neck killers. I say to patients, just bin the laptop, put it to one side, plug it into your desktop, plug it into a monitor, so you can avoid using the laptop. People end up on sofas and on beds with them, and they always cause problems. Hands-free kits are great. I love mine. I use mine loads. It just makes it so much easier. It saves me hunching my neck holding a phone. And I've got a double screen system, so I've got a nice work environment, but using 1 or 2 screens and raising them up to the right height is really important. To reduce inflammation on your neck, apply ice, 10 minutes of ice, very much like the back. A lot of chronic neck and back problems, it's a chronic inflammation. And if we can break that pattern of inflammation, we can actually get loads of pain relief. And ice is a great way. Some people actually even prefer heat, and heat can be great as well. We often start with ice and then go to heat. But try an ice or heat or a combination of both. It's really what works for you. But 10 minutes of ice wrapped in a tea towel, or you can get like an ice pack, or you can get one of these blue packs that you put in the freezer once or twice a day, just applying it to the back of the neck can be really, really good. Neck pain exercises. So there's, like with the back, there's dozens of exercises that you can do, and I've just picked out 3 straightforward exercises just to keep your neck more mobile. So again, the neck, like the back, it's made up of these sort of 7 vertebrae, and they love being mobile. They love twisting and turning. It's like your neck is like a radar. It's like a radar on your torso. So it houses all your sense organs, and so you can use it to look, to turn, to look, to bend, to move. So the neck loves to be kept mobile. So a great exercise is just a neck rotation exercise, looking left and right over your shoulder to get the mobility back. Now, a lot of people will be stiff, so you might only be able to reach to, say, 45 degrees, about there. In a normal neck, you should be able to reach along the line of the shoulder, so between 70 and 90 degrees. And improving neck rotation just makes a huge difference to neck pain. And as physios, we always try and promote regaining full range of mobility. So lots of neck stretches, lots of rotations, 10 times each side, 2 or 3 times a day. And again, side bending exercises like the lumbar spine, like the lower back, where we bend left and right. We can do the same thing with the neck, just to bend left and right 10 times each side. Now, of course, if you get any pain, stop the exercise. I mean, you guys know this stuff. If it doesn't feel right, don't do it, get advice. But the exercises, 9.9 times out of 10 will help. If it hurts you, that's fine. Stop it, let it settle down, or seek advice. But start gently with them. I mean, don't go crazy. Don't try and do 100 repetitions. Listen to your body. Gently bending the neck left and right just to improve mobility will definitely help ease things up. And the last exercise is the neck retraction. So it's a bit of a physio's favorite, this. But the idea behind it is you just gently tuck the chin back, and what you're doing is you're just encouraging the neck just to get used to coming back a little bit. So we often have forward head postures. Yeah, and you can see my neck muscles are really having to support the weight of my head here. And if we just bring the neck back, then we take a lot of pressure off these neck muscles. Now, posture is a big problem. And if I asked 100 people, I could pretty much tell you that 100 people would say, I would like to improve my posture. Well, why is posture so important? I mean, you know what? Having good posture, it makes us feel good. It gives us confidence. It gives us a bit of a spring in our step. You know, when you have bad posture, you've got your neck down and you're looking down to the ceiling and the shoulders are rounded, and that's so commonly associated with low mood and feeling down and a lack of energy. You know, when we have good posture, you know, we open up and we look good and we smile and we lift our chin up and we just, you know, everything tends to work better. It's almost like with good posture, we're beating gravity, and with bad posture, you know, we're succumbing to gravity. And posture is so important for breathing mechanics. Even in, I'm doing a talk later on COVID rehabilitation, and they say posture is so important for COVID rehab as well, because, you know, breathing mechanics is a fundamental process of something of what we do thousands of times a day. And when we have good posture, it's much easier to breathe deeply and fully. When we have bad posture, we're rounded, you can't expand the chest so easily. So maintaining good posture is so important. It's so important for back pain as well, because when you become rounded, it puts stress through the back and it stretches the muscles and it makes our backs weak and can make our backs painful. Maintaining good posture, it can help take stress off our backs because we're more in line with the center of gravity. So posture exercise are great. Now, posture exercise, anything where we tend to open up our shoulders is good. So we tend to get short through here. So let's try and open up our postures. We can do an exercise where we take our arms back behind us and just hold that stretch for 30 seconds. Yeah, that's a really nice exercise just to open up our chest. And, you know, you can really feel the stretch going through the forearm and the upper arm and the chest and into the fingers. We can do something as simple as just reaching right up above our head and touching the ceiling. That encourages extension to our backs, encourages extension to our necks. That just helps us become less rounded because we're sitting all day rounded, and this just does the opposite. So reaching up above your head just helps to extend the back. And another cool exercise, I just found, put this one together, and it's just an exercise like climbing the rope. It's just another strengthening exercise for the arms, and an extension exercise encourages us to sit upright and prevent bad posture. And you know what, so often we just need to look holistically at our lifestyle. So many problems can be prevented with just 2 or 3 simple lifestyle changes. The first and so important is just weight loss. You know, it's so important at the moment. It's so topical for COVID. Me and a couple of my staff did training for Nightingale Hospital. We weren't called for Nightingale, but we did the training for it, and we were on standby to go and be redeployed at Nightingale. And the doctors were saying there, out of the 35 beds that were currently in use when we did our training, every single one of those patients had diabetes and were obese. And it's just so important with all aspects of our health, with our backs, with our knees, with pressure on our joints, with pressure on our cardiovascular system. I can't stress enough, and I have a personal mission when I work with patients about weight loss, is just, guys, you know, do what you can to reduce weight. It will immeasurably improve your life. The best way is to eat good nutrition and exercise. You know, eat a good balanced diet, eat healthy. And I'm not going to sit here and tell you I'm an angel. I'm not. I have pizza once a week. You know, and I don't eat chocolate, so that's a good thing, but I do, you know, I like ice cream, so I sometimes have ice creams, and I eat biscuits sometimes. But 80% of the time, 80-90% of the time, I try and do good things with my nutrition. So we have as much organic food as we can, and we try and eat good nutritious food, and we try and cook from scratch and not eat processed foods. Good nutrition is about eating good food, eating the right quantity of food. You know, when you have good nutrition, you don't need big meals. When you have bad nutrition, you feel hungry, like you need a big meal, and so you eat more. But when you eat good nutrition, you can eat smaller meals. And if you eat smaller meals, you're putting more nutrients in, but less calories. And if you put less calories into your body and then you start exercising, you burn more calories, you will lose weight. You know, it will happen. It takes some time, but yes, it will come off. It's just a calorie game. Reduce the calories, exercise more, burn more calories, and the weight will come off. And you exercise, you know, a lot of people will say, well, I can't exercise because I don't have the strength in my knees because, you know, because I've got too much weight. You know, you can buy a static bike from Amazon for 150 quid and you can do 20 minutes of cycling, and pretty much anybody can do that every evening, twice, 3, 4 times a week. Do that with eating smaller meals, and you'll lose weight. You can go walking. Okay. When in gyms reopen, swimming is great. It's great for the back. It's great for weight loss. And so cycling, walking, and when lockdown ends, swimming are all key things to do for your back and for weight loss. So that concludes the talk. If you need any support, then you know where we are. Just call a GP surgery. And try these exercises as well. And I'm just going to invite anybody that wants to ask any questions. I'll remind you that this is going to be this is recorded, so please don't ask do anything that might where you don't want to share any information. But if you want to ask something and you want to share any information, then I will open it up and answer any questions. So if anybody does want to, let's just end my slideshow.
Hi.
Then I welcome any questions.
Hi.
Hi.
Can you hear me?
Yes, we can hear you.
Hi, sorry. I recently suffered a stroke last February. I'm 41 years old, was fit and healthy. And then in December of the same year, I suffered a brain hemorrhage. So I'm still in recovery. I'm still trying to process the whole thing within a year, having all that happen to me. Now my mobility is an issue because I can walk, but there's times when my knees collapse under me. I also, my neck, the neck pain and the back pain are constant for me. I mean, I'm living in pain. And I think, the operation I had was coiling. So the neck pain gives me a little bit of anxiety because these are the things they ask me to look out for at the hospital if I get any neck pains or any migraines. So I haven't had that much physio because I came out of hospital in January and we went into lockdown in March. So I'm just wondering if FCP is something that can help me at all.
It's definitely something that can help you. I mean, can you just tell me what can you do? Can you easily get out of bed? Can you walk around the house? Could you go to the shops?
No, I wouldn't be able. I can't do those things by myself because of my anxiety for falling. Number one, and two, I do walk with support. And if I do tend to walk a little bit too much, I need to sit down. And sometimes when I come home, my knees or my legs will swell.
Thanks for speaking up. I really appreciate it. And this is, it's a tough case, and I think you've got a lot of good spirit. I can tell you've got a lot of spirit, and that gives me a lot of confidence that you're going to make a good recovery at some point. But it's a long journey and it's a hard journey. Strokes are obviously extremely debilitating. They can be very severe. They can be on a real scale of very, very mild to very, very, very severe. I've done a fair bit of stroke rehabilitation, and it can be very challenging, and it takes a long time and a lot of persistence and a lot of dedication and a lot of motivation. I think you've got that. So yes, in answer to your question, FCP can help, and we can put you onto AQP physio and get you some rehab. And we can't support you for the next 12 months, but we can support you intermittently for 3 or 4 sessions, and then you go away and do the exercises, and then we can do another course a little bit further down the line.
Right.
And we can look at you and give you the exercise that you need. Yes, the knees will buckle because the knees are weak, and you have clearly a confidence and nervousness issue with getting outside, because that's normal. Once bitten, twice shy. Following any big injury, following any big stay in hospital, we're seeing this exact thing with COVID people who are coming out of intensive care. It's very tough psychologically, and it's very tough physically. There's going to be some muscle atrophy from not using those muscles, but you can get it back. The nervous system is incredibly plastic. I've seen people make amazing recoveries. You're still young enough to make a great recovery.
Yeah.
And it's a lot harder when you're 80 than when you're 40. So, you can do it. I'd say you've got to push and push and push yourself to get out, to mobilize, to strengthen the muscles. And if there's anything we can do, you can call the GP surgery. We start next week, the FCP service.
Okay.
And see Tommy from next Wednesday, and he will be more than happy to see, and he'll guide you on where you go. We can't give you as I said earlier. But we can give you support.
That's brilliant. Thank you so much.
Thank you. Does anyone else have any questions?
Yes, I'm Simona.
Hi, Simona.
Hi. Actually, I tried the physiotherapy before. I have this sciatica from 9 years. And I tried the physiotherapy as well. And after I done the physiotherapy, was not helping me at all. And was worse, painful.
Yeah. Okay. So you've just sciatica. I'm guessing it's going down. The pain's going down one leg, is it?
On both.
On both legs. Okay.
Yes, but not same time. It's sometime on the left, sometime in the right. And before 2 years, I was fall down straight away, and I cannot move at all from 2 weeks. Not even to go to bathroom, or not even to turn around on the bed.
Yeah. How's your pain now?
I need, when I wake up in the morning, I need to walking slowly, 2-3 hours before I need to go somewhere, and holding my back or holding something on my head. And GP all the time is give me naproxen. He don't want to do nothing else for me. I don't know what shall I do in this case.
So again, there is help and there's support for you, and you can get some great help in Wandsworth, and you can get and let's talk through your options. The first thing is to be mindful of, if it's been going on for 9 years, is what's causing this. Is there something that you're repeatedly doing? I'm typically with sciatica, you often sit in people that do a lot of repeated forward bending. You may not, I may be completely wrong, but I always say to my patients with chronic sciatica, please reduce the forward bending that you're doing. People just don't realize how often they're leaning over, they're leaning over to pick up cups and glasses and to make beds and to clean their teeth, and they're constantly bending. I mean, we have this exact same problem as physio, so I'm constantly bending over a treatment table, which is why I slipped my disc and had sciatica as well, and have done on and off for 14 years. And they very much need to be managed. I mean, once you get sciatica is usually caused by a disc problem. So usually the disc bulges and it can touch the nerve. Obviously, if you get any, as I mentioned at the beginning, if you get any symptoms of incontinence or numbness around the anus or anything like that, or any loss of sexual function or any electric shooting pains going down the legs associated with those, you should get to A&E and get it checked urgently. So there's a number of things we can do. The first thing is to try sort of a course of hands-on physio.
Physio, I done it 2-3 years ago, from 6 months, but after I'm doing the physiotherapy for half an hour or something like this, I cannot move from the bed 2 days. It's more worse pain.
Yeah, so in some cases it doesn't work. I wouldn't rule out trying another course of physio. I think it's worth doing that because there's different teams and different ideas around treatment and options, and I think someone would want to work with you and try and improve it. But if that fails, then other options are, I mean, if you get to the stage where you just feel like there's no other option, then the next step is really a referral to the orthopedics team at St George's, you know, and then we can arrange for you to see the orthopedics team. Now, certain interventions they might do might be an epidural or injections. They might refer you to the pain clinic, and they may well do an MRI scan to see exactly what.
I done the MRI scan. I done.
Yeah.
On the December or January exactly. I'm not sure.
Okay. And so I think we need to have a really good look at the MRI scan and really determine what is the cause of your back pain and how to manage it moving forwards. And back pain is sometimes not curable, but it's often manageable. And if we take the pressure off our backs and we get mobile and we do the right exercises, often the back does sort itself out. So I think you need to work with someone. You need to get in. You need to see a good starting point is our FCP, or if that's if you're really at your last wits with it, then the orthopedics team at St George's. I think that may not be face to face at the moment, but once COVID settles down, as it's been going on for 9 years, you know, you may just need to manage it a couple of more months and then get referred to the orthopedics team and get re-reviewed and see what other options there are. And it may be injections, it may be more physiotherapy.
Okay.
But don't give up hope, and you know, let's look at it again and check your back and see if we can look at the exercise doing. We can change the exercises or give you different ones. You know, we try this route, try the natural route, exercise, get mobile, stop loading the back, you know, take the pressure off the back.
Okay.
Okay,
thank you so much.
My pleasure, Simona. Any final questions before we wrap up?
Hello, Tim. Can you hear me?
Yes, I can. Hello.
Hello. I've got a question about running.
Yeah, sure.
So I've had a lot of trouble with sciatica and a bulging disc. And I love to run and jog, which I obviously can't do anymore. Is that it for me? Like, will I ever be able to run again? Because I've been told it's very impactful. But, I mean, if you work with sports team, you can't just tell them not to run, can you?
Yeah, I see disc bulges in Olympic athletes, and we cannot tell them not to run again. And my own personal experience of having disc problems is that I actually am fine running myself. So it very much depends on the disc problem. So running is definitely not a no-no for disc problems. And I personally don't tell my disc patients not to run. I just advise caution. So my first thing to say is that there are better things for the back than running, and that is cycling and swimming.
Well, we can't swim at the moment, can we? Well, unless you've got your own pool, but not many of us in Wandsworth do.
Yeah, I mean, exactly. And I touched on this earlier. So swimming's obviously out of the question at the moment, but I think it'll, you know, hopefully it'll come back quite soon. But if we were outside of COVID, I would say swimming and cycling are your two best low impact exercises that you can do to keep up cardiovascular fitness. Now, running is not 100% out of the question. You've got to first of all determine, does my running cause my back pain and hence cause my sciatica? Okay, so the way to test it is to go for a gentle jog, let's say a 5-minute gentle jog, come back and then monitor next 24 hours. Is my sciatica and back pain worse as a result of going for that 5-minute jog? If yes, you're pretty certain that you've either got to do a lot more work on your back to strengthen it, or running is not for you. Okay, now actually it might have been fine, a 5-minute jog, and or even if you don't want to jog, go for a fast walk instead. Okay, and then try a 10-minute jog, and then try a 15-minute jog, you know, and gradually build it up and see how your back tolerates it. Because For me, I mean, for me, I was able to run a marathon in 2010 despite having a back problem in 2006, and I was fine with my back. My knees, on the other hand, were horrific. I had to have about 30 physio sessions to get through because of my knees. But my point is that some people are fine to run with disc problems, and some people find it's aggravated. So you've got to work out which category of those you're in. But I certainly don't say no running. I just say build it up slowly. Be mindful if it's causing a problem. If it's not causing a problem, then usually you're fine. Just build it up slowly, challenge your body slowly, build up tolerance, build up your endurance, and see if your body adapts.
Thank you. I think I'm in the latter group. I think it does aggravate it. Would wearing like a back brace help, or is that like a different thing?
Not really. So back braces tend to be short-term good, but not long-term good. So we really want to improve the muscle strength rather than rely on a back brace. They're very, very good for short-term lifting. So let's say you wanted to go and move a fridge. Stick back brace on, support the back. It's like a corset that holds everything in, and then it gives you the strength. But for running, probably not.
Right. Yeah, I'm also not lifting many fridges. It's just mainly glasses of wine or breakfast or something like that. Okay.
Yeah, I mean, if you do find just a short period of running, I mean, I would try gentle running. But look, the other option is you improve range of movement, improve stability and strength to your back, so it can tolerate running. I don't want to say never run again. It might be the case that you can't. I mean, sometimes that's the case, and in those cases you do need to switch sports. So cycling is probably one of your best options.
Cheers. Okay, well, thanks for that.
No worries. So before I wrap it up, maybe one last question from someone, if anyone wants to ask anything. No, good. Well, I hope you found it useful, and it's lovely to connect with you guys and meet you. And I wish you good health and a good recovery from this terrible
Thank you.
situation. Thank you. So I hopefully wish you all the best and good luck with it all. Take care.
Thanks a lot. Bye.
Bye.
Thank you.
Pleasure. Cheers. Bye bye.
Thank you.